CO2 fractionated laser, form of resurfacing and skin tightening. It's been used for a long time, but the new technology is even better because we can essentially laser and leave some skin in between each pixel of laser. That allows the skin to tighten but not cause any discoloration or wound healing problems. So we get much better tightening, less complications than the old lasers. A lot of people are afraid of CO2 because they hear these stories about people having bad reactions to it. Fractionated CO2 is much better than the old method. The way CO2 works is the laser is absorbed by the water in our skin. When it hits the skin, it vaporizes the cells where the spot hits. And so you have a very small hole that's drilled in the skin, and the surrounding skin heals around that, forms collagen and tightens. So if you drill millions of these holes in the skin, you can get a overall tightening and smoothing of the skin that you really can't do any other way. And you can treat a lot of different areas of the face, including around the mouth, cheeks, the jowls. You can treat the eyelid skin, the crow's feet, the forehead. It's very versatile, and you can treat all skin types. It's really effective in thin skin patients where you have thin, crepey skin and wrinkles. It works really well in older patients where their skin is thinning as they get older. And it works well in patients that have scars and acne. So it's really a good laser. Something I've been using for over 20 years. The procedure is pretty simple. We have patients come in about an hour before surgery. We apply a topical numbing cream to their skin, which numbs the skin to the point where they can tolerate this laser. The laser is pretty aggressive, and it's meant to be, so we want their skin to be numbed thoroughly. And it does sting when you get the laser, but it's something that most people can deal with in the outpatient setting. So we numb their skin for an hour, then we go in and do the treatment. Treatment takes usually less than an hour for most people. Afterwards, they'll look like they've had a bad sunburn, but the healing's pretty rapid since it is pixelated. You have this normal skin that's in between, and that healing goes much faster than it would normally if you resurface the entire surface of the skin. So we do that resurfacing. Takes about a week or so for the healing to progress. We usually see you in the clinic a week afterwards. We have you apply a laser ointment after surgery that helps with the healing process. And yeah, it takes about 6 weeks for the full healing, but most of our patients look fantastic afterwards. So that's the type of treatment that we do. We do a couple types of CO2 fractionated resurfacing. The more intense version is 180, which is a smaller spot size, and it goes deeper. It's more aggressive. And then we do a 300, which is a bigger spot size. It doesn't go as deep. It's less aggressive. We call that CO2 light, and it's mainly for general resurfacing of the skin where you don't have a lot of wrinkles or scars, where you want your skin to look better. It smooths the skin. It does stimulate collagen. It does look really good afterwards. But typically I let the nurses do the CO2 light, and I do the more aggressive, deep CO2. Really, it's a case-by-case basis where we can do deep or more superficial CO2 light, but it just depends on the patient. We'll have to evaluate each patient and determine how aggressive they want to go in terms of the laser treatment. Normally, we pre-treat the patients. When a patient comes in that's considering laser resurfacing the skin, we do a consultation, we do a skin evaluation, we skin type the patient in terms of their Fitzpatrick level and how much skin damage there is and the amount of laxity and what treatment's going to work best for them. Typically, if patients have darker skin, we recommend that they pre-treat their skin for several weeks before the procedure to prevent pigmentation problems after the procedure. So usually the pre-treatment involves using a retin-A cream and a hydroquinone, which is a pigment reducing chemical. Once the skin is adequately pre-treated, then we'll do the laser treatment. No, it's actually really good in combination with other surgeries, and a lot of times they would combine CO2 resurfacing with an eyelid surgery or a facelift surgery or any type of facial surgery. It's actually a good complement with those procedures. Typically, if we're going to do resurfacing, we can do it in the office and then do the surgery, or we can reverse that, do the surgery and then do the treatment. CO2 laser is good for a lot of people, especially people where they have sun damage to their skin or Their skin is getting thinner as they get older. It is great for treating wrinkles. It's great for treating focused areas on the face. A lot of patients do have wrinkles around their lips and their mouth or around their eyes, and they want to treat just those areas. It's a really underutilized treatment because I think there is so much fear from the old days when the CO2 laser wasn't fractionated like it is today. So the new fractionated lasers are much better, and I think patients need to see before and afters and look at the kind of results we're getting to see the benefit that they might have with this laser. So yeah, I mean, it's really a great tool for taking care of skin that's been damaged by the sun or just aging skin that needs to be rejuvenated. I don't think there's anybody that's not a candidate.